Hello, good morning, and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. Going to be having a conversation this morning with Dr. Emily Lopes, Gastroenterology Clinical and Research Fellow at Massachusetts General Hospital in Boston. And she's joining us to talk about an abstract presentation from DDW 2020, or Digestive Disease Week 2020, entitled Dietary Gluten Intake and the Risk of Inflammatory Bowel Disease Among U.S. Women Without Celiac Disease. Welcome to Health Professional Radio, Dr. Lopes.
Thank you for having me, Neil.
Now, of course, I did mention that you are a Gastroenterology Clinical and Research Fellow at Mass General. Give us a bit of your background and describe your role there at Mass General.
Absolutely. So I earned my medical degree at NYU School of Medicine and then completed my residency and chief residency in internal medicine at MGH, where I stayed on for MGH Gastroenterology Fellowship, and I'm currently a second-year GI fellow there. I also have a bit of clinical research training from the Harvard School of Public Health. And my main role as a GI fellow is to both learn and practice clinical gastroenterology, but also to forward my clinical research in the field of inflammatory bowel disease. So a lot of my time is currently dedicated to IBD research, and I have an interest in how diet and nutrition intersect with IBD, or inflammatory bowel disease.
Digestive Disease Week, or DDW 2020. Is this a major conference? Does it happen every year? Talk a little bit about this Digestive Disease Week.
It is. It's one of the major gastroenterology conferences of the year, and it does happen annually. And it's a great time for researchers and educators in the field of gastroenterology to come together and both share their own research findings over the course of the year, as well as learn from others about what other institutions and what other academic gastroenterologists are doing across the nation and actually across the world.
Now, you presented an abstract there at DDW 2020, the title of which was Dietary Gluten Intake and Risk of Inflammatory Bowel Disease Among U.S. Women Without Celiac Disease. What was the purpose of this study?
That's a great question. So our study aimed to explore whether gluten intake, what people are eating in their sort of day-to-day diets, conferred an increased risk for inflammatory bowel disease. And the inflammatory bowel diseases include both Crohn's disease and ulcerative colitis were the main two that we looked at.
Why the lack of celiac disease? Is celiac disease not an inflammatory bowel disease as are the others?
So celiac disease is not considered one of the inflammatory bowel diseases, though it is an important disease to consider here, because celiac disease is a disease where the body mounts an immune response to gluten, so eating gluten in the diet. And there are some links between celiac disease and inflammatory bowel disease. There are some studies that would suggest that if you have one, you may be more likely to have the other. So in this study, it was very important that we exclude celiac disease so that when we're looking at the association between gluten intake and risk of inflammatory bowel disease, that we're really just looking at that association uninfluenced by potentially someone else having celiac disease at the same time.
Are there any lifestyle? I mean, as far as diet, is gluten everywhere? Is this something that we can't escape if we have a problem with it?
It is certainly tough. So gluten is a protein that's found in wheat, barley, and rye, and those encompass a lot of the things that we eat in our day-to-day diet. And it can even be found in some not so obvious things like condiments that you put on different foods. So it's really important, if someone has celiac disease, they really want to know all the sources of gluten in their diet. But it can be hard to escape. And I think for a lot of reasons, gluten is getting more attention by both the general public and the medical community for its potential role in a multitude of patient symptoms and diseases. But as of yet, we haven't really looked at whether eating gluten confers a risk for inflammatory bowel disease. So that's sort of the point of this study, is to explore if a relationship existed there.
How does this gluten intake risk or lack thereof differ among men and women, and why women in this study?
It's a great question. So since submitting our abstract to DDW, we actually also expanded our findings to include a cohort of men as well. And I will go through our findings in a second, but at least from what we observed, we did not see a differing association between gluten intake and men or women.
So what were some of the major findings and some of the important takeaways?
Yeah, so in our study, we followed over 208,000 participants from the Nurses Health Study, the Nurses Health Study 2, and Health Professionals Follow-Up over 20 years of time. And these are just cohorts of nurses and health professionals that have been followed over many years and who have had data such as their diet, exercise, medications, and diseases tracked really closely over time. And so we then basically estimated how much daily gluten are these folks eating, and that was based on their completion of food frequency surveys every 4 years. Mm-hmm. And then we performed our analysis to explore whether higher amounts of gluten intake in their diet were associated with higher rates of new IBD. And we found that dietary gluten intake was not associated with an increased risk of either ulcerative colitis or Crohn's disease, the two main types of IBD.
So you've basically been able to exclude that cause.
That's what we're hoping. So there are some limitations to this study, like all studies. And one of the important limitations here is that this is an observational study, mm-hmm. which just means that we didn't perform any intervention. We simply observed what folks were doing in their daily lives and then analyzed what the dietary choices they made were and how that may influence IBD risk. And that's different from the gold standard study, which is the randomized controlled study. And so our study may be subject to some bias. We do try to control for that in our analyses, but it's important to outline that limitation.
Even without that potential bias, do you think that the results of this study may alter dietary guidelines down the road for the American Medical Association or the CDC or anyone else having to do with dietary intake as far as gluten is concerned?
It's a great question. And I think that at least our results reassure folks as of right now that preliminarily we don't see a signal for eating gluten and that posing a risk for someone getting something like ulcerative colitis or Crohn's mm-hmm. disease. But I think it's worth more exploration to make sure that we're truly doing the sort of gold standard type of study over time to make sure that we're investigating this and putting that sort of question to rest.
Where do you see research in your field going as a result of some of the results of this study and some future studies based upon this?
I think it's an exciting time for investigation in the field of nutrition and IBD. You know, we generally accept that diet must play a key role in how IBD develops and behaves over time. And while we are just starting to gain some of these insights into these relationships, we don't fully understand the exact ways in which diet may impact IBD. Mm-hmm. So I think we need, and we'll start to see over time, more dietary registries that allow us to prospectively and randomize studies to investigate dietary interventions for IBD down the road, which I think will really help inform, like you said, some of these decisions and recommendations that are being made on nutrition and IBD.
Give our listeners a website where we can learn more about DDW and maybe a little bit more about dietary gluten intake.
Absolutely. So the page that I like to refer most folks to who have inflammatory bowel disease and they're looking for sort of nutritional guidelines or nutrition information is the Crohn's and Colitis Foundation webpage. That's crohnscolitisfoundation.org. And then the DDW website is ddw.org, and on there you can see a lot of the information about submitted abstracts and different exciting updates in the field of gastroenterology.
Dr. Lopes, I appreciate you coming on and speaking with us here on Health Professional Radio this morning.
No problem. Thank you so much for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Emily Lopes. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.